All right, let's get right into it. If you're running a rural hospital in New York, you know the ground is shifting under your feet. This isn't just another memo. Think of this as your survival guide for the brand new world of state and federal funding. And let's be perfectly clear about the stakes from the get-go. This quote really says it all. We've moved way beyond just checking boxes for grant compliance. What we're talking about today is the fundamental make-or-break requirement for your hospital's survival. It's that serious. So, here's our game plan. First, we'll break down the new rules of the survival game. Then we'll zero in on the main prize, the RHTP. After that, we'll look at your strategic toolkit of other grants, explore a really game-changing alternative, and wrap it all up with a concrete roadmap to get you from here to action. First up, the new survival game. And the big idea here is simple, but it's profound. The old financial model you've been relying on, it's officially over. Business as usual is done. That's because the whole era of just getting by on predictable fee-for-service revenue is coming to a close. See, New York State isn't interested in just propping up the status quo anymore. The new focus is all about systemic restructuring. They're not just handing out cash, they're funding a fundamental transformation through a whole new ecosystem of grants. So, what does this new ecosystem look like? Well, that brings us right to the main prize. At the absolute center of this new landscape is the Rural Health Transformation Program, or RHTP. You're going to want to pay close attention because this is the big one. And when I say big, I really mean it. New York State is aiming to get a $1 billion slice of a massive $50 billion national RHTP fund. We're not talking about a small grant program here. This is a historic level of investment, and you need to get your hospital positioned to get a piece of that pie. Now, this is maybe the most important slide for your strategy, because the way the money flows changes everything. The federal government, CMS, gives the money directly to New York State. Then the State Department of Health is the one who distributes it. So what does that mean for you? It means you are not applying to the federal government. You're applying to New York, and your proposal has to be perfectly aligned with what the state wants to see. So, what does the state want to see? Well, pillar number 1 is a non-negotiable. You have to partner up. The state has made it crystal clear they want to fund coordinated rural health partnerships. A standalone application asking for general support, it's dead on arrival. The strong proposals, the ones that get funded, will be joint applications with a regional health system, a network of FQHCs, or some other strategic partner. Pillar 2, you've got to embrace technology. The state is specifically looking for projects that deliver technology-enhanced primary care. And listen, they're not just talking about the telehealth setup you've had for years. They're getting specific about wanting to see proposals that incorporate artificial intelligence, things like AI-driven remote patient monitoring that can expand primary care without you having to build a single new build. Pillar 3 is all about your people. It's about building a sustainable rural healthcare workforce. And honestly, this is a huge opportunity. These funds can be used for pretty much everything, from immediate fixes like retention bonuses and loan repayment programs, all the way to long-term solutions, like building your own training pipeline with local community colleges. And the final pillar, harden your digital defenses. Rural hospitals are a huge target for cyber attacks, and the state knows it, so they're making dedicated funds available specifically for technology innovation and cybersecurity. This isn't just a suggestion. You can literally apply for money to pay for firewalls, security audits, and the infrastructure to make your telehealth secure. Okay, so the RHTP is definitely the centerpiece, but it's not the only tool in the shed. Let's move on and talk about your strategic toolkit, because there are other critical programs out there designed for very specific challenges. Let's quickly put 2 of these tools side by side. On one hand, you've got the safety net program. That's for when you're financially distressed and need immediate operating cash, like right now. On the other hand, there's the statewide healthcare facility transformation program, or SHCFTP. That's capital money specifically for those big IT and cybersecurity upgrades we were just talking about. But let's go back to the safety net program for a second, because there is one rule that trumps everything else, and you absolutely have to get this. You cannot apply alone. The law explicitly requires a joint application with a partner. This is the state practically forcing integration, because they believe it's the only way to ensure long-term stability. Here's another tool for your kit, the 1115 Waiver. Now, this is a potential game changer because it creates a brand new way to get reimbursed for work you're probably already doing anyway, like screening patients for social needs, food or housing insecurity. The only catch?
To start billing for it, you have to have a contract with your region's designated social care network lead entity. Okay, so we've covered a lot of grants, but now I want to pivot to a really powerful, game-changing option that might just be the key to your long-term future. It means rethinking your entire hospital model. So let me ask you this. What if the best financial opportunity available to you right now isn't a competitive grant at all? What if it's a fundamental change in your hospital's designation? This is where we need to talk about converting to a rural emergency hospital, or REH.
And here is the financial hook that makes this so compelling. If you convert to an REH, your facility gets a guaranteed annual payment. For 2025, that's projected to be over $3.4 million. That's revenue that comes in every single year, and it has absolutely nothing to do with how many patients you see.
So here's the trade-off, and it's a crucial one. In the old model, you're saddled with the high, often crippling fixed costs of keeping inpatient beds open, especially if your census is low. In the REH model, you close those acute care beds, and in exchange, you get that guaranteed annual fee plus a 5% bonus on all your Medicare outpatient services. You're basically shifting from a high-cost, high-risk model to a lean, financially stable one.
Okay, I know that was a ton of information. So for our final section, let's pull it all together into your winning roadmap. This is how we turn all this knowledge into decisive action.
Think of this slide as your command center. It's the opportunity matrix. You can look right at this and immediately see which program aligns with your hospital's specific situation. Are you in immediate financial trouble? You look at the safety net program. Need to fund a huge tech project? You focus on RHTP and SHCFTP. Is your inpatient census critically low? Well, then it's time to seriously start modeling that REH conversion. And here's how you can map this all out into a concrete 12-month action plan. In the first 3 months, if you're struggling, get that safety net letter of interest submitted with a partner and get your contract going with the social care network. For the next few months, start preparing those RHTP proposals and get a cyber audit done so you're ready for the IT funding. And then in the second half of the year, do a deep, serious financial dive on REH feasibility and formalize those critical partnerships. When you boil it all down, the state's message couldn't be clearer. The money is following a very simple mandate: partner, modernize, and integrate. The era of trying to go it alone is over. So the only question left is the one you have to answer. What will be your first decisive move?